Hello, everyone. My name's Aline Sigler. I'm going to be one of the hosts for this special event. Also on the line with me is my friend and colleague, Karen Curtis. You'll hear from her a little later in the presentation. Karen and I are members of the Provider Outreach and Education team. Today's special event is a collaboration with our appeals department. They work diligently to process your redetermination requests and a lot of other associated tasks. So we're excited to have you hear directly from them today. So as we look at the next slide, let's talk a little bit about our objective and our agenda today. You can see the objective for the course listed here: to achieve a greater knowledge of the Medicare appeals process. This course was designed as a Q&A session, but will also provide guidance on how you can give us feedback about your redetermination experience. And we're going to share resources also where you can go to learn more. Next slide, please. We had a great turnout for this webinar, and we are also excited about that. A lot of you asked questions during the registration process. So we're going to start with some of those pre-submitted questions, and then we'll mix in some of the ones that have been entered into the chat later on. Any questions that we don't get to today will be compiled, and we'll send the answers out to everybody that's in attendance today. Now I'm going to turn things over to our appeals staff. They'll introduce themselves and then start with the question and answer session. Please go ahead.
Good morning. Thank you for taking the time to attend our Appeals Q&A webinar. My name is Amanda Lingle, and I'm a Part A Senior Analyst in the Appeals Department, and I'm going to be going over the material to address the questions you had pre-submitted. I also have Samantha B. on the line with me, that is a Part B Senior Analyst in the Appeals Department, to help answer your live questions at the end. Please remember, during the live Q&A, we cannot answer specific claim questions, like Aline said, but we will answer the best we can, and if we can't answer your specific question during the session, we will send a follow-up email to address your specific question. We had a lot of great questions, and many of them were similar in nature. We have gone through and sorted the questions in related groups so we can provide as much information as we can in the time allotted. The first topic we are going to cover is the submission of appeals. You have 120 days to submit your appeal request from the date the claim finalized. So if you had a claim finalized and your remit shows a pay date is today, 5/6/26, you will have until 9/3/26 to submit your appeal request. If you are trying to appeal after the 120-day time frame, you will also need to include good cause to bypass timely filing. There are 4 different ways you can submit your appeal. 1 is through our portal, 2 is via mail, 3 is ESMD, and 4 by fax, but that is for Part B claims only. So when you're submitting your appeal by mail, WPS has different post office boxes for whichever MAC or whichever contract you belong to. So what you would first want to do is log into our website, and then you will need to either select J5, A or B, or J8, A or B, to where you can get your correct address. Once you make that selection, you're going to go to Contact Us, and then under this field, you're going to go to Appeals. So I'm selected on J5 MAC Part A here in the Appeals, and this gives you all of our addresses if you're deciding to mail your appeal in. Down below, we also have the second level QIC addresses for you if you do not have those available to you. It's important to send your appeal to the correct address, because that's how our mailroom sorts what department and jurisdiction the documentation should be uploaded to. Regardless of which method you choose to submit your appeal, you will want to make sure you are clear on what you're appealing by sending in a redetermination request form filled out entirely along with your reason for appealing. So I've got an example here of a redetermination request form with the information that all these boxes should be filled in with what you're appealing, the dates of service, patient name, Medicare number, the service you're appealing, and all of your information down here. This is important because if there is an issue with your documentation or your case and we need to reach out, it is best to have a valid phone number to reach you at. If we aren't sure what you are appealing and what we need to review, then your case could possibly be dismissed for us not knowing what codes or what services you're needing appealed. We had a lot of questions regarding the process of submitting appeal or the appeals process in general. So now I'm going to go over the appeals process and provide information on timeframes and how to submit. You can also find this information under our Topic Center under the Guides and Resources. Once you submit your Level 1 request, it will go into our system for review. Your case will be worked in order it was received. We have 60 days to process your appeal request per CMS guidelines. We strive to have them completed as soon as possible, but depending on our inventory, it could take up to the full 60 days. So please be patient and allow us sufficient time to process your request. Once your case has been reviewed, if a favorable decision is made, then we will adjust or key your claim. No letter will be sent for a favorable decision. If we find it partially favorable or unfavorable, then you will receive a decision letter explaining why we are issuing that decision, and then you will be able to appeal to the second level QIC. A second level QIC review must be filed within 180 days of your Level 1 decision. If the QIC finds your request unfavorable, then you will need to appeal to the ALJ, and you have 60 days from the date of the QIC decision to file to the ALJ. A Level 2 QIC or Level 3 ALJ request is another review of documentation by another entity. They might review your documentation and find something in that documentation that you submitted that was sufficient to pay your claim. Sometimes providers will send us documentation for Level 1. We determine that that documentation did not support the services, but Level 2 or 3 might find something within that documentation or new documentation submitted to them that does allow it to be payable. And again, on our website here, how to appeal a claim determination, all of this information is listed as far as your timelines and the time frames that you have. And these links will be in our chat as well. Another question we had was appeal process when claims are denied in error. Should we continue calling or utilize the portal? To start, you would want to check our portal for system issues. I'm going to pull up a slide to show you that. We have alerts out on our WPS page that will advise you if you go to this WPS page and click on this box up here, it'll give you all the system alerts, and it will let you know the date it was reported, if it's still open, if it's been resolved, and you can click on these and get information about it. If you don't see your denial issue noted on the portal page, then you can call customer service at the numbers listed on the portal. It could be that it's possibly a new issue that they are not aware of yet, but by calling them and having them review, then they will advise if they feel it's a system issue, and then they will notify our systems team and put an alert on our website, or they will advise you to submit an appeal. If you see there's an alert on our portal, you do not need to file an appeal for these issues. If your claim is one of them that is affected and already identified, our systems department will do a mass adjustment to reprocess the claims that were affected as part of the system issue. And that's on most of these statuses, you'll see no provider action is needed. Do not submit appeals for this issue. So like I said, if you do realize this code that you were inquiring about is on here, it is being reviewed, systems is working on fixing it, then you don't need to take any further action. You can also call Provider Contact Center to check the status of your appeal. I'm sorry, if you submit an appeal request, providers are enrolled in WPS SNAP, Secure Net Access Portal. You may check the status of your appeal using SNAP. Select the Part B Appeal Status function in WPS SNAP for instructions on how to use this function. If you submitted your appeal request through the portal, you could use your tracking ID provided at the time of submission to search your cases for information. So what you would do is go into our portal and click on the appeals button here, and then enter that tracking number down here, down at the bottom, for it to pull up your case. Once you do that, your tracking number is entered, your case should come up down here at the bottom. You can click on that eye icon, and then that will take you into your case. That's where you can see your status of it, if it's still open, what the decision is. You can retrieve your decision letter in this part here. And if you received an unfavorable decision, this is where you would need to click to submit your Level 2 appeals to the QIC. You can do that all through the portal. When your claim is displayed at the bottom, you'll click the icon and go to the next page. We also had several questions regarding redeterminations versus clerical error reopenings. Our guides and resources section on our website, shown here, goes over the information regarding what can be done as a CER. A clerical error reopening is for minor omissions such as updating a diagnosis code, a HIC pick, a modifier. CER reopenings may be requested to correct minor error omissions. CERs cannot be requested to add items or service that were not previously billed. An easier option for Part A claims, if you know what caused your claim line to deny and what information is needed added to your claim to change, you can allow it to pay. You can adjust your claim through DDE or submit a corrected claim on a UB form to our claims department with the changes made. Since CERs are worked in the same time frame as redetermination requests, it could take up to 120 days for you to receive payment for us to review and key your claim for you. But if you submit a corrected claim yourself through DDE or paper submission, your claim will process much quicker. A redetermination request should be submitted for claims that are rejected or denied due to either medical review, SMRC, UPIC, CERT, RAC, and you do not agree with the review of your claim, or if your claim was denied and it wasn't something that was already reviewed by another contractor and you feel your claim was billed correctly and it should have paid. This will require documentation to be submitted along with your request so our appeals clinicians can review the medical records compared to what you have billed to see if the documentation allows payment of the service that was denied. For Part B, you would need to make minor changes. You have the option to do a reopening, either in the portal or in writing. However, if your claim is denied, it would be faster to submit a new claim. Now, in the redetermination request section of what documentation you submit for your redetermination, when you are appealing a denied service, you need to submit documentation pertaining to that service and specify the date that the service related to. Some patients might have lengthy records, especially in a Part A inpatient claim. If a patient was in your facility for 30 days and there was a date of service that denied for an edit you feel should have been paid, please only present your documentation related to the date of service that would support the request. If we receive several hundred pages, it's hard to sort through all of that documentation to find specific material related to the denial, and that can cause an unfavorable decision simply due to so much documentation being submitted. By taking the time to sort through the documentation prior to sending and only sending in what pertains to the service and the date the service was performed, it will result in a more accurate review. Some providers submit the entire medical records thinking it would be easier for us to determine if the service should be paid, but in the end, it's more of a burden for us to sort through hundreds of pages to find relevance to your service that is being appealed, and it could result in an unfavorable decision because the documentation pertaining to that service could possibly be overlooked due to the volume that they're trying to review. For the questions of what is needed for an appeal, what documentation is appropriate, and what information should be included. As I stated earlier, the redetermination request form filled out completely with what information related to the services you are appealing and an explanation indicating why you are appealing them. Documentation pertaining only to the item or service you are appealing. For clerical error reopenings, you would need to submit a CER form and a corrected UB to indicate what changes you're requesting to be made to your claim. If you are requesting a clerical error reopening, you do not need to submit documentation to support your services. With the CER, you are requesting specific changes to be made to your claim. So we just need a corrected form to show us what changes you want to make, and no documentation is needed since these do not go under clinician review. However, please keep in mind, if your claim was medically reviewed, you cannot submit a clerical error reopening to request changes to be made. Those will be reviewed by a clinician, so documentation will need to be submitted on all claims that were medically reviewed. Now we are moving on to the general questions that we had. For Part A, we received a question related to claims in T status. In order for you to submit an appeal, the claim must be finalized. If the claim is RTP back to you, you can go in and make corrections depending on what your claim is being returned for. If you do not know what to do to fix your claim, you would want to first review the reason code narrative that would tell you why your claim was returned to you. If you're still unsure what to do, you can contact customer service to get the information as to what is needed to be done to allow the claim to process and get past the edit it's RTP'd for. But since the claim isn't finalized, an appeal cannot be done on it, so that would result in your request being dismissed. For a question we had related to claims denied incorrectly, this goes back to the information I presented earlier. If systems is aware of a processing issue, they will complete a mass adjustment to reprocess all claims affected by the system issue. That's why we suggest you review our portal to see if the system alert out there before you submitting an appeal to see if there's a known issue. If nothing is reported, then contact customer service, have them review the information you're questioning to see if there's an issue. If they had not yet identified, they will contact our systems, an alert will be put on our page, and when the system issue is fixed, a mass adjustment will be done to all affected claims, so no appeal is needed. Most of the time, the mass adjustment will be performed while your appeal is waiting on review, and by the time we get to your appeal request, the mass adjustment has already reprocessed your claim, so we just have to send a paid letter. So that would save you time on submitting your appeal request and save us time of having to send out a letter and review a case if you took those appropriate steps before submitting an appeal. For Part A question related to MSP, if the services are not related to the primary insurance, such as no fault or workman's comp, if you put this information in the remarks section of your claim when you submit the claim, it should not reject for the MSP edit. But if the patient has an open MSP record and there's no indication that it was not related to MSP and you have Medicare listed as primary, then it will reject with an MSP edit. For the question we received on how to successfully file and get claims paid correctly and per contracted rate. All claims that are pay at the current rate for that year. When you're reviewing reimbursement of your claim, please make sure you are viewing correct year's rates to calculate payments. We have a very high volume of appeals related to reimbursements, and they do not provide calculations before submitting their appeal. If you feel like your claim did not pay correctly, we ask that you show your calculations so we can determine if it was a calculation error on your end or if there is a system issue that is paying claims incorrectly. 96% of our appeal requests we receive regarding reimbursement disputes are found to be unfavorable because they did pay correctly. So it's a cost for you to submit an appeal for WPS and the cost of us sending the letter to say it was paid correctly just due to a calculation error on your end. We also received a lot of questions regarding timely filing and how do we get a reviewed claim denied timely due to other payer recouping retro terming their member. This is also something we have information on our portal. Timely filing does not have appeal rights. If your claim was rejected for timely filing, you will need to submit a corrected UB or 1500 form to our claims department along with information why your timely filing should be bypassed. Or if you haven't even billed your claim yet and you know it's past the 1-year timely filing limit, you would want to send a UB form or 1500 to our claims department along with the recoupment documentation from the primary payer, and the claims department will key your claim and bypass timely filing once they see the recoupment occurred recently. We also had some specific questions that was not able to be addressed in general information, so I'm going to go over a few additional questions before we open up the floor to live questions. One question was, why are the G2211 being denied when billed with an E&M office visit? CMS IOM 100-04, Chapter 12, Section 30.6.7 states, effective January 21st, claims with HCPCS add-on code G2211 reported on the same day of service as an outpatient evaluation management code reported with the modifier 25 could be billed when a service identified preventative service list is also present for the same dates of service. So that information is out on the IOM if you would want to go check your IOM before you submit your appeal on it to see if what you're submitting the appeal for, you can get your information off the IOM. Another question, how to bill a claim if a patient is deceased on scene after the ambulance is dispatched, my claim rejects and my appeal rejected. This information is also available in IOM 100-04, Chapter 15. It states that the beneficiary dies after the ambulance is dispatched, but before the beneficiary is loaded on board the ambulance, before or after arrival of the pickup point, Medicare payment determination is provided or supplier's BLS rate, no mileage or rule adjustment. Providers or suppliers report the 0428 non-emergency or 0429 emergency transport HCPCS code if an emergency response and modifier QL. But again, the full information of this is on the IOM. And the last question we had specifically, G0260 is not being paid based on LCD guidelines. LCD states rolling calendar year, which means the year will begin at the start of the first session. Yes, that is correct. The year starts with the first session. A maximum of 2 diagnostic sessions, adding the KX modifier indicates that the code is diagnostic, and 4 therapeutic sessions may be performed within a 12-month rolling period. We also had some vague questions that were submitted that we were unclear on what you were requesting, and so now I'm going to open it up to live questions that you may have. If your question was not addressed in the information I provided already, please list your questions in the chat and we will provide answers to as many questions we can until the end of this session. So Aline, I'm going to go ahead and turn it over to you and Karen for the questions.
Thank you so much, Amanda. There's a lot of great information. We did get some questions coming through in the chat. The first question that we got is in regards to AI and appeals. Courtney asks, have you found that this is helping claims to be paid more?
We have seen a lot of issues with AI. We've received a lot of appeals that seem to be invalid, that we feel that AI is generating an appeal, but it's not submitting anything correctly. The appeal is kind of invalid because the information the AI is picking up on doesn't seem to be clear information for an appeal request. Without having specific claim information, like if you had a claim that was submitted that you received an unfavorable decision on and it was submitted AI, you could always reach out to us and send us some specific examples so we can kind of look at that specific claim and see what might have been noted on there that would have indicated to us to issue an unfavorable decision, but without seeing a specific claim to know, what situation was in that, I couldn't give a direct answer. I mean, AI can be great, but sometimes, whenever we're receiving appeals that we're like, we don't understand what they're trying to say, then we're kind of conducting, is this an AI submitted request? Because the request just doesn't seem clear.
I agree. Thank you for that. And I think AI is something we're definitely going to see more of in the future. This is Aline again, and I have another question that came in. This one's from Paul. Are there any updates planned for the web portal? I've had multiple loading issues for the appeals when searching for them. Can you speak to that?
I can get a little bit of information. I don't work in the portal team, so unfortunately I don't know, what updates they're currently making. I know when they do have issues, they do have a team diligently working to fix the issues. Of course, with, every system, you're going to have issues at times, sometimes here or there. From whenever I have spoken to providers previously, regarding their portal issues and submissions, and I've reached out to our portal team, they said, it would be better to try the next day and see if it continues to have issues. If so, definitely reach out to our customer service and let them know so that way they can make the portal team aware. That way if they hadn't identified any issues yet, as long as it's getting reported, then they can start looking into it. But yeah, they're constantly trying to improve our portal and make it a better experience and make it flow a lot easier, upload documentation easier. And sometimes it also could be an issue with the type of documentation you're uploading. There are specific portal requirements to upload to the portal. Your file size, the type of the file, the name of the file. So you'd want to look through our portal requirements to see if what documentation you're trying to upload is meeting all those guidelines, because a lot of times that is the issue, is that the file name was too long or the file size was too long and needs to be split up. So I would definitely recommend doing that. If you know that you're following all of the guidelines for the portal submission of documentation, then definitely reach out to our customer service and make them aware if you're seeing an issue, an error message pop up.
Thanks, Amanda. We got another portal-related question also. Diane says, I used to be able to go into clerical error reopenings and mark the line I wanted denied, but I don't see that option now. Did something change? And if so, what is the new process? And again, this is the portal, so I'm not sure that you'll be able to answer this. We may have to get some additional information.
Yeah, I was going to say I mean, I've not been made aware of any changes to the portal such as that. So if you could please send us a specific message or detail, more information. That way I can reach out to the portal team and, answer that question specifically and accurately because, like I said, since I'm not in the portal team, I don't know, if they've changed anything or something on the provider's end that would cause that.
And just to add a little more to that, this is Karen Curtis. I do portal education. I do monthly webinars on different functions of the portal. And the portal team is always, like Amanda said, constantly working to do updates and make things more user-friendly, things like that. So Amanda, I can help and we can look into that.
That would be great.
Thank you. All right, the next question is related to what you stated when you said only send the documentation related to the claim that's being appealed. And just for clarification, does that also stand for Part B outpatient therapy denials as well? Only sending the dates denied versus the entire record?
I'll let Sam.
Amanda?
Sam is our part.
Yeah.
Oh,
Amanda,
Sam.
I can take this one. I actually did reach out to one of our clinicians and found out that for the outpatient therapy, you would need to send the therapy records from the start of care through the data service that you're appealing.
Thank you. Thank you so much, Amanda. Thank you, Samantha, also for providing that information.
Okay, I can get the
Karen, what else
next.
have we got?
Oh, sorry about that. The next question we have is, can you correct an incorrect NPI for a therapist via a clerical error reopening versus writing a redetermination request appeal?
And
So,
I can
I'm
take
sorry.
this question
Okay.
too.
Thanks,
Yes, you can. Yes. You can do it via the clerical error reopening instead of doing a redetermination. Yes.
Perfect. Thank you. Now, this next one, if we have to look into it more, we certainly can. I'm just going to read it verbatim. If the Office of Inspector General requires a claim to be reprocessed that is over a year old, does an untimely waiver need to be filed first? The claim was still in DDE, and I attempted to do an adjustment. What is the correct process when it's requested by the OIG to submit an adjustment? That may be out of the scope of what we're talking about today, but I'll let you make that determination.
Yeah, I would have to see the specific claim example to provide more information on that, just to see what the situation was in total. Because like I said, it could be a variety of different responses depending on what was submitted and when it was submitted for timely filing overrides. So I would definitely need to see the case itself. So if you could send that information over to Eileen and Karen, and we can look into it and get back to you on that.
Okay, now we did receive a question, and it's not really something that's being handled today, so I want to provide some more information before I see if Amanda or Samantha has anything to add. Um, the question is, I am hoping to see how to check in the portal for prior ADRs and submitted records, in addition to the findings letter for TPEs. We have a facility who didn't alert anyone of a probe review, and we are trying to see the claims out and outcomes of reviews. That is something, and the girls can correct me if I'm wrong, but that is something that would be handled by the medical review department. And there are going to be some upcoming webinars about like ADRs and things like that. And there have been some medical documentation where we have talked about findings for reviewing TPEs, like where you can find those letters. So we do have some additional information out on our live events encore page, but I'll let Amanda or Samantha see if they wanted to add anything else to that.
Yeah, I agree with you, exactly what you said, Karen, as far as getting additional information for them to present, to be able to send them specific information. I can't provide an answer to that off the top of my head. I don't know if Samantha can provide an answer to that or not.
No, yeah, I would agree that would be medical review. I don't know how any of that works.
Okay, thank you. Next question comes from Wendy. Can you please discuss rejected claims and how to get them to reprocess via Medicare, as the portal does not allow you to do anything from there?
So for Part B, if you have a rejected or an unprocessable claim, those claims do not have appeal rights, so you would not be able to do anything in the portal with those. You would need to get your claim corrected and get it to us correct to get a valid claim denial, or get a claim to go through that's not rejected.
Okay, thank you, Sam. The next question we have is, you stated you wanted paper claims for MSP timely filing. I didn't think Medicare wanted paper claims. So I know, Amanda, you had brought up that web page. Can we just go back to that really quick for the timely filing? Thank you. So usually if it's a first time filing a claim, no, Medicare does not want paper claims unless you're a facility that has a paper claim waiver. For timely filing, the reason that they asked you to submit those paper claims is so if your claim, like if they do find that your claim meets timely filing exemption, then your claim can be adjusted. So they'll have a copy of that paper claim so that they can adjust it. With MSP, we always suggest that you file those claims even if Medicare is not primary, because there seems to be a very high it seems to occur very frequently that those primary payers end up taking their money back. And I know appeals kind of gets bogged down with a lot of MSP denials. So this is just something that if it is timely filing, there is an exception where you can file a paper claim. And Amanda, if you want to add anything to that, please feel free.
Yeah, I'll just add to that. Yeah, correct. It is best to go ahead and bill it, even if you know there's a primary payer, just that way the claim is out in the system. So then that way, if they do take it back, then you've already got your claim billed, showing that you tried to bill it to Medicare. But yeah, when you're submitting the claim, if you know it's not related to no fault or workers' comp, something like that, you can add comments in your remarks section of your claim when you're submitting it through DDE and say not no fault, not workers' comp. And then that way, when that wording is on there and they review your claim, then it should bypass if the claim, was truly not no fault or not workers' comp. It'll bypass and it'll avoid you from having to send in documentation and adjustments later on, because that it will be bypassed because you're already stating in your original submission that it wasn't related to those. But yes, like I said, on our website, it does say an original UB form, hard copy adjustment, plus any documentation to reprocess the claim if they took back their payment and you're asking for the claim to be processed after the time frame.
Great, thank you. Next question. Latanya received a favorable appeal decision on March 30th of this year. We still have not received payment. How long does it take to receive payment after a favorable decision?
Whoever asked that question, was it a QIC decision or a ALJ or a level 1 decision? Can you clarify that? because if it's a level one, and why I ask that is because if it's a level one, when we do our appeals process, we review it, we send it over for effectuation, and then it gets adjusted.
She says
If
yes,
the
it was
QI
a level 1 decision.
Okay, we would have to see that claim-specific information. It could have been that possibly it was a favorable decision, but then after reviewing, you know, or when they went to key the adjustment, something could have happened and realized, okay, this was not, it should not have been a favorable decision, and they might have reopened the case and issued an unfavorable decision. But I would have to look at the case specifically to be able to provide you additional information as to, you know, what happened with it and give you more information.
Okay, thanks, Amanda. Next, we have Paul that said, I uploaded a level 2 QIC appeals on the QIC's portal. Now, we only upload QIC's appeal in the WPS portal. Is that correct?
Well, when you say you uploaded them to QIC portal, I'm not for sure what you're referring to on that. But yes, you can go into our portal and click on that box that I had showed previously. Let me see if I can get back to that one. And then that way you can click on that button down here that says if you were issued an unfavorable decision, to learn more about second level appeal rights, click here. This is where you would click on to submit your appeal to the QIC. So unfortunately, I'm not familiar with what you're referring to about submitting to the QIC directly previously, and now you're needing to do it this way. So if you want some more additional information or clarification on that, if you could please send us an email with the additional questions and your case specific so I can look it up and be able to give you some more information on that.
I do want to just point out one thing here. That level 2 submission is only for Part A. That is not available to Part B providers right now.
Thank you for that clarification. Next question states that redetermination decision letters are a little vague. This makes it difficult to appeal when the reasoning is so vague, and it seems like the explanations have decreased significantly in information. Do you have any comments or any guidance on that?
Well, I would like to see which letters they're referring to be able to give maybe some more information to where, if it was worked by a clinician, we can have a clinician review and possibly give some more explanation, or the examiner. We always appreciate feedback on what providers would like to see from us to where we can, do better information or education. It all depends on what the claim was found unfavorable for, what the denial and edit was. To where, I could say, okay, for this specific case, this is what the situation was and why the description was there.
Amanda, can you hear me?
This is something. Yes.
Yes, thank you. I couldn't tell if I came off mute or not. Hi, this is Lita Way Hunter. And Kaylin, I did respond. It looks like you replied to my response about this. So my question is about, so I'm assuming you're talking about our appeals decision letter that you're quoting, and I asked, okay, yes. Do you know if that language isn't something we typically use, but it could be something that the medical review department, if they did a TPE for this service prior to, you appealing it, but also if you could look at that letter and let me know if there's a guideline or IOM cited in the letter, because oftentimes we're quoting at the IOM, and there's usually more information with more details on what exactly does that mean in the IOM. So while we're still live on this call, if you respond with the IOM, I can kind of respond to you via chat, and then we can move on with everything else. Thank you.
Thank you, Lita.
Yes, thank you guys. The next question we have is, What do you recommend on the rare occurrence when a demand letter is not received?
So you're saying that you did not receive, I'm trying to think of the situation. Sam, do you have some information to provide?
I can probably take this one. I think maybe they're talking about a Part B overpayment demand letter is maybe what they're talking about. So basically with, whenever there's an overpayment on your claim, you do not want to submit that appeal request until you've received a demand letter, because we are not going to ask for that money back until you receive that demand letter. So I would not recommend submitting any appeal until you get your overpayment demand letter.
Thank you. That helps. Next question. When submitting the medical records for the appeal, do you need to send the records for the procedures on that claim that paid as well, or just the denied procedures?
Try and send documentation that pertains to the service that you're appealing. Because like I said, if you send just everything, all the medical records for that patient, I mean, for Part A, I can say, related to Part A claims, some of these cases have thousands of pages of documentation, which is very time consuming to look through. Lead Away, she is our nurse supervisor. She might be able to give more education as to what exactly they look for within the documentation regarding an appeal request. But like I said, I just know that you don't want it to be too much documentation. I think it's more helpful to have it pertaining to that service for that date specifically. But I'll let Lead Away provide some additional information that she might feel is important to it.
I apologize, Amanda. Can you repeat what the specific question was?
Regarding the documentation submitted, if it's for a specific procedure code, on what type of documentation you look for when you're doing your review on those, if it's a specifically denied line.
Did they give the procedure code in the question, or is this a general?
No,
I'm
it's just a general.
Okay. I'm not, there's a lot of questions, so I'm not finding it to lay my eyes on it myself, but so I will be generic in my response. If someone who posted this question, if you had a specific code, if you could post it, I'm watching the chat. But in general, almost always we are looking for a legible, signed and dated physician's order to support that the service that you're billing and was denied was ordered by a licensed, MD, DO, PA, NP. That's almost always necessary to support medical necessity. There are exceptions to that, such as if the provider is administering the drug themselves, for example, or if the provider is doing, the service themselves, like a colonoscopy wouldn't most of the time need an order. But we also would need whatever the documentation is to support that service was actually provided as billed. So in the case of a colonoscopy, we would need a colonoscopy report for that data service for that beneficiary. That's, to ensure that you build the correct procedure code, and, same with any type of drug administration, we would need a MAR. If it's a laboratory that you're billing and appealing, we would need the laboratory report, and so on and so forth. So those are the two main pieces of documentation you'll need to send for almost everything. And then there's also a lot of the time, there's also a guideline that we follow, a CMS guideline or a WPS LCD that we as nurses follow and review your records against to ensure that the service was medically reasonable and necessary. And obviously each guideline, whether it be an NCD, an LCD, IOM, has its own requirements for medical necessity specific to that service. So Again, that's a high-level response, but I hope that was helpful.
Thank you, Lead Away.
Yes, thank you both. That was a lot of great information. The next question we have is, can you do a clerical reopening to update the PTAN for the treating provider, or do those need to be faxed?
I'm trying to think of the situation party. I think I'm gonna have to look into that and get back to you, because if you build with the wrong PTAN for Part A, if we adjust it, the information of the other PTAN carries over. I'm trying to think if we don't normally have that situation to correct the PTAN. So I'd have to look into that for you and get back to you on that. Sam, do you have any information for Part B related to updating the PTAN on a CER?
Well, I know that you can update the PTAN on your claim in the portal for Part B if you're changing it to a PTAN for an individual that's in that same group, that's in the same group that your claim is already billed under. So for Part B, yes, you can, but they have to be in the same group.
But that's just the individual PTAN, not the facility PTAN, correct?
Right. The facility PTAN cannot be changed. We can't even do that on redetermination. You would need to do an overpayment on your claim and then resubmit a new claim.
Yeah, that's where I was thinking along the Part A lines, is that you can't just go, because whenever you try and adjust a claim, it's going to automatically pull over that PTAN from the original claim.
Yeah,
so I think you would be better off
is.
to cancel that claim and cancel it out, to where it's no longer active, and then just rebill a new claim with the correct PTAN and MPI. I don't believe I've ever seen that situation come through as an appeal request before, so that's why I wasn't really for sure how to respond to that. But yeah, I think that you would have to do it that way, because I don't think it would allow you to just change the PTAN through CER.
Okay, thank you. Next question. What's the best route to appeal a claim that was denied from the RAC for no records received? Is redetermination the correct course of action?
Yes. So whenever you receive a denied claim and the RAC has denied it for no medical records, then yes, you do have to submit those in as a redetermination. Now, you do need to keep in mind that when we work those, we have our 60 days to make our decision. And then once we make our decision and realize that it needs to go to our medical review reopening department, they also have another 60 days to review that claim. Once they make their decision on their claim, they have another 60 days to adjust that claim. So I would definitely suggest trying to get a response to the RAC within that time that they allow you. I think it's maybe 45, 60 days. I'm not sure what they allow you, but my suggestion is definitely to try to respond to those RAC requests, SMRC requests, any of those, those post-payment reviews, the UPIC, any of those. If they ever request records, you definitely want to try to get those to them within the time allotted, because your only option once there's an overpayment is to send in a redetermination, and that can take time.
Okay, thank you for that. We do have a little bit of closing information to go through, and we have gotten a lot more questions in the portal, or I'm sorry, in the chat. Some of them are portal related. So I do want to let everybody in attendance know that after this webinar has ended, we are going to go through all of these questions that you've entered in the chat, and we'll get a look at them and give everybody some time to respond. I mean, some of these questions um, are a little detailed, and it might just be too much to try to go through here. So we will come up with a follow-up email. We will send it to everybody that is in attendance today so that you'll be able to know what questions we got in the chat, and we will be able to get those answers for us. I do want to tell you, like at the end of the slide, what Amanda's showing here. We did provide you with some resources that we think that we would find helpful, or that you would find helpful. We do have a list here of WPS appeals resources. Some of these Amanda showed you earlier, and some of them are things that you can go through and look at and see if you'll find helpful. Amanda, on the next slide, we also have some CMS appeal resources. So this will provide you with some guidance from CMS. Also, your input is crucial to help us improve our processes. So WPS does have a survey for those who have submitted a redetermination request in the last 90 days. Contact information isn't required, but it could be helpful if there are questions regarding your feedback. Now, you can find a link to that survey on the right-hand side of the Appeals Topic Center on the WPS website. Amanda, if you can go back for 1 second. There you go. The screenshot shows where it's located. So you got that little blue box there. Okay, now we're ready for the next slide. So when you disconnect from the webinar, you are going to be redirected to a CMS survey. This survey is to provide feedback on how Aline and I did today. The redirect does look like what you see here on the right, and we just want you to know we don't have any control over how this appears, and so we show it to you just so that you know it's not spam, it's nothing malicious. If you are viewing this in an encore, then the survey is going to look like that picture you see with the stars. Go to the next slide, Amanda. Well, that brings us to the end of today's presentation. We will be following up with you guys, so don't worry if your question didn't get asked today. We will get back to you. On behalf of myself, Aline, and the WPS Appeals team, I would like to thank you for being here today, and I hope that you will join us for future events. You may now disconnect.